And now, from Washington's leading news station, this is News 4 at 4.
More on RG3's knee injury. We'll check in with a doctor to find out just what it will take for him to recover and get back out there on the field.
It was a big win for Washington over the weekend against the Ravens, but fans were holding their collective breath after the game because of that play during the fourth quarter. RG3 running the ball. He got hit hard, and we're learning now that he suffered a grade 1 sprain to his right knee. So what kind of recovery could he be in for? That's the question everybody wants to have answered. Dr. Jason De Luigi from the MedStar National Rehab Network joins us now. Thanks so much for being with us.
Thank you.
So we heard Coach Shanahan say this afternoon during the press conference that it is a grade 1 LCL sprain. How serious is that? And compare that to the injury that RG3 suffered in his sophomore year at Baylor when he injured the ACL and spent most of that sophomore year sidelined.
Yeah, so with the knee, you have 4 different ligaments that provide stabilization to the knee. So the ACL, like he had injured back in Baylor, is the anterior cruciate ligament, which also has a posterior cruciate ligament. And then you have the medial and the lateral collateral ligaments. So this injury here is to one of the ligaments on the outside of the knee, which is the lateral collateral ligament. So when you're looking at the different grades of it, so grade 1 is a sprain to the ligament itself. Grade 2 would be a partial tear, and grade 3 would be a complete tear, which would be much more severe.
We know it was very painful.
Yes, you could see immediately, when he had injured his knee, and it was, quite painful. And he admitted to himself during his press conference.
Were you surprised that he went back out for 4 more plays, or 3 more plays?
I was. So just from the amount of pain you could see that he was in, he had tried to push through the injury as much as he could, and then he realized that it was probably causing him too much discomfort to continue.
And it probably would it have caused a lot more damage had he continued to play?
There's definitely a chance it could have, because it was a sprain, so there would be disruption to the ligaments.
Okay, so what kind of treatment are we looking at?
So oftentimes you could do well with conservative management, utilizing a brace to help it heal, and so he'll be having a knee brace with the lateral sides to it, which gives support. He may or may not be on crutches. We'll see how the pain goes with that.
How long does it generally take that to heal?
Well, with a grade 1 sprain, oftentimes you can do well with 1 to 2 weeks. But sometimes up to, depending on the amount of pain, could up to 2 to 4 weeks.
So when he declared he'll be back out there against Cleveland next week, you doubt that?
Well, no. It depends on how much pain that he has throughout the week.
Okay. All right, Dr. De Luigi, everybody is pulling for him, rooting for him, and hoping that he gets back out there soon, but not too soon.
Not too soon. You want to make sure he's good and healthy for the rest of the playoff stretch and push and stretch down the road.
All right. Thanks so much for joining us. Jim, back to you.
Yep, we've got a lot invested in him. Thank you, Doctor.